So the first thing is to recognize that kids always know something's going on. They can intuit it even if they're not 100% what is. And what they imagine it to be can actually be a lot scarier for them to what actually is. So talking about what's going on with appropriate language and concepts for their age is very important. It usually helps by starting out to ask, what do you know? And how are you feeling? Ask if they've heard about the coronavirus or COVID, and if they have any questions or fears. Make sure you validate those feelings. Don't just brush them aside, but also don't dwell on them. Act calm, stay calm, and say, it's okay, understand how you're feeling, and then here's how we're going to deal with it. Make sure you're correcting misinformation. Kids are connected in lots of ways to different media without the correct information. And share ways that you and they can stay healthy and safe, keeping yourselves safe as well as others. For example, if they can't see friends or grandparents or go to their classrooms like they're used to or would have liked, help them understand that this is us staying home to keep everyone safe. And always acknowledge that things will get better, and it could take time, but they will. And we want our kids to have that hope, just like we need that as adults for our own well-being. Keeping kids connected is also really important. So try to schedule things like video chat, play dates, video messaging with grandparents and others. A friend of mine developed an app called Caribou, where grandparents, teachers, others can actually video chat and read a story or play a game like tic-tac-toe. It's become very popular. So there's a lot of technology that can help with this social connectedness, but even things that are meaningful, like writing a letter, sending texts to people that they know, or even socially appropriate video games can really make a difference for kids. Lastly, make sure to build routines for you and your family as part of your plan, and try to include the older kids and the adolescents in the process. Those routines, as we've talked about, should be focused on those 6 areas that are shown to buffer or prevent toxic effects of stress. So staying connected with others, exercising, sleep, nutrition, mental health, and mindfulness. Keep to that regular schedule, the regular hygiene routines you always had, and make sure everybody has time as part of the plan for creativity and fun. Sometimes that gets left out. For parents, that's the same thing. Keep to your routine, but also don't schedule every moment. Give yourself a little bit of leeway. Adjust your expectations. Recognize that this is temporary and your time is not going to be as productive as it had been, and hopefully those around you are supportive of that. Make sure if you need it, you're asking for help and you're taking time. Like I said, the connection to others, including professionals, can make a huge difference, as well as just a few deep breaths that can go a long way toward keeping everyone safe and well.